we're going to cover is how to strip back an IV catheter, do the checks of it, and you would be doing this standard once a day, but it also gets done if the pump was occluded in any way and you needed to check the IV catheter. So we're going to have to cut the bandage off. So just cut the knot, or if it's in a bow you can just undo it and just unravel it all. And the checks we want to make of the catheter are that this swab area that's been positioned underneath the catheter is all clean. Obviously this is a potential source of infection for the patient, so if it gets contaminated in any way we would have to cut this swab off and place a new one. You'd be best doing that though with one of the nurses rather than trying it yourself. So this is nice and clean. I want to feel the leg above the catheter site, just to make sure there's not any swelling, there's no evidence of fluid collecting, and you can compare it to the opposite side. If you're not sure, just have a feel of both sides. This feels okay to me. I would want to check that the paw wasn't swollen. Sometimes, especially in cats, if the bandages are put on a bit too tight, it obstructs the venous return and the paw will swell up. So it's really important that, you know, throughout the day when we're checking catheters and we're flushing catheters, we check the paws aren't swollen and we check up here. Then we want to check the patency of the catheter. Stay, sweetheart. So I would take my bung off, place it on my tray so it's not going to get contaminated, and then I'm going to put my syringe, good girl, stay pups. I'm going to connect my syringe to the T-connector and then unclamp it. I always try and pull back first to see if I get any blood. If you're getting blood back, chances are your catheter is patent and it's in place. So we can see, and I'm not putting a huge amount of pressure on there, it's just gentle pumping just to try and get some blood back. So I can see some blood there, so I'm pretty happy that this is going to be patent, but you always want to flush it with a volume. And it should flow fairly easily. There is a bit of resistance in this catheter here, which would potentially make me question whether it was actually in place even though I am getting blood. Sometimes you can aspirate blood from the kind of surrounding tissues and it's not actually venous blood you're getting back. So this isn't flushing as smoothly as I would expect. So what I would probably do is get a colleague to check this and see what they think. And then if you're in doubt, you know, once you've checked with one of the qualified staff, if there's any doubt as to the patency of these catheters, we don't want to just reconnect them and let the fluids keep running, because all that will happen is the leg will get swollen. You know, it's uncomfortable for the patient. So we would probably opt to change that catheter with into a new leg. If you're happy you've flushed it though, you would just reclamp your line, disconnect your syringe and pop your bung back on it. The next thing we need to do is just rebandage it. Oh, Kira. So we've got some soft band here. We're just going to cover that up with a nice wee layer. Leave this hanging free because we need a bit of length to be able to get into it to clamp it off, so we don't want to cover that up fully. And then a wee bit of white bandage. This doesn't need to go on tight at all, it's really just providing a protective covering rather than performing a kind of supportive measure. So cut it, stay sweetheart, and then just tear it down the middle, give yourself a decent length, tie it one time just to stop it coming so you can wrap it round, and then do a wee bow. I tend to prefer to do bows rather than knots because it means it makes it easier to undo it, or you don't have to have scissors to cut it. And that's her ready to be reconnected.